Let's talk a little bit about coronary circulation. We have spent a lot of time talking about the anatomy of the heart and the chambers of the heart and how blood flow moves through the heart, out to the pulmonary circuit, out to the systemic circuit. This topic is focusing on how we get oxygenated blood to the heart muscle itself. So how do we feed the heart? So in reality, again, coronary, that term coronary means heart. Remember, when we think back to our systemic circuit, we have this drawing that I have done for you where we have our heart, right? And so remember, we divide the heart into our right side and our left side, and we can pump blood out to our lungs and fill it up with oxygen. When it comes back to the left side, we can pump it out to our body's tissues. We call that our systemic circuit. Feed our tissues, and then bring that spent blood back to the right side. We do it all over again, right? So remember, we have this at the top. This is feeding our lungs, the pulmonary circuit. Feeding our body tissues is the systemic circuit. Now, also remember, anytime blood is flowing away from the heart, away from this circulation here, it's traveling down an artery. Remember, artery means away. And anytime blood is flowing toward the heart, it's flowing through what's called veins. Okay, so again, we've used those terms before. So let's go back and let's talk about coronary circulation. Again, this is feeding the heart muscle itself. And so this is going to be part of the systemic circuit. So it is the systemic circuit, it's blood leaving the heart itself through an artery and going into your body's tissues, right? So we say that the arteries that are feeding this particular tissue, which is your heart, are coming from the base of the aorta. And that should make a lot of sense because the aorta is right there. It's that large artery that is leaving that left ventricle. It's filled with nice oxygen-rich blood. And so at the base of the aorta, there are some branches, some arteries that branch off to feed your heart muscle. You have a left and a right coronary artery, and these are going to branch profusely and create capillaries that truly infiltrate the heart muscle and supply it with oxygen. Now, removing the blood, once your heart muscle uses up oxygen and nutrients to create energy, it also generates CO2 and waste. So we have to remove the blood through cardiac veins. And cardiac veins are going to drain those capillary beds, and they're going to collect all of that spent blood into the coronary sinus. And the coronary sinus, remember, is going to empty into the right atrium. So I'm going to skip back to this picture that we just did a video on, where again, remember, when we look here at our right atrium, remember what's draining into that right atrium is spent blood, everything coming from above the heart through the superior vena cava, everything from below the heart through the inferior vena cava, and everything from the heart muscle itself from that coronary sinus. Okay, so when we talk about the veins that are draining the heart, they're going to pull all that blood in the coronary sinus, and the coronary sinus is then going to dump that blood back into that blood circulation pathway so that the heart can pump it out to the pulmonary circuit and fill it up with oxygen. Okay. Now, this is a great image. This is basically just showing you an anterior view of the heart. And in the anterior view, we can see some of these major arteries, right? We can see the right coronary artery, which is over here, and the left coronary artery over here. And what I want you to see, and I know it's kind of hard to tell, this right here, this is the aorta. And you can actually see the coronary arteries are actually coming from the base of the aorta. They're trying to make that pulmonary trunk see-through right there. So those are deriving right from the base of the aorta. You can see they branch a lot, and they're trying to show you all these little capillary beds where they're feeding the heart muscle itself. Okay. If we look at the image on the bottom, this is looking at some of the veins. We can see some of these cardiac veins draining the heart, and they're going to collect that blood here in our coronary sinus, which will then dump into the right atrium. Now, there are a couple of imbalances that are associated with not being able to get blood flow to the heart muscle itself. So if any of those little vessels are blocked, if they're clogged, maybe there's a blood clot, maybe somebody has atherosclerosis, but if blood cannot pass and get down into that heart muscle, then there will be damage. So one imbalance, one condition is called angina pectoris. This is also called choked chest. And this is when there is pain associated with a deficiency of being able to get blood to the heart muscle. Now, one of the key words that I want to point out here is fleeting. This is a fleeting deficiency. So it's worse and it's better. It's exacerbated and then it's a little bit better. And so what happens here is the cells will get weaker because they don't have a constant supply of blood, but they're not dying. They are getting weaker. Now, angina pectoris typically is a condition where you need to see your doctor. If you are having pain, chest pain, you need to see your doctor and make sure that there is not a deeper underlying condition that could eventually lead to something worse, like a heart attack. And a heart attack is called a myocardial infarction. This is prolonged coronary blockage. So one of those vessels supplying the heart muscle is blocked for a long period of time. And that means that those cells are being deprived of oxygen and nutrients and they're dying. Now, typically what will happen is when cardiomyocytes die, when heart muscle cells die, those cells get repaired with scar tissue. You know, if you've ever cut yourself, you know, if it's a bad enough cut, you have a scar does not look like the surrounding tissue. It looks totally different. Same thing in the heart muscle. So if heart muscles die and you replace it with scar tissue is not muscle tissue. It is not contractile. And so this is going to cause the heart to get much weaker. Now, the most serious of heart attacks would be one that affects the blood supply that supplies the left ventricle. And I want you to think about why that is. Remember here, when we look at the heart, remember the left ventricle, and the wall of the left ventricle I told you is really thick because it's got to have a lot of force to pump out to your body circuits. Remember your body organs. Remember, this is supplying the systemic circuit, right? So if you deprive that side of oxygen and of nutrients, those cells will die very quickly. The left ventricle will get much weaker and it will not be able to really forcefully move the blood out where it needs to go. And your tissues will start to starve. They're not going to get oxygen and nutrients the way they should. So that's the most life-threatening.